Otitis externa can have multiple causes, including allergies, bacteria, yeast, parasites, such as ear mites, or foreign bodies. Risk factors. Dogs with floppy ears or V-shaped bent ears are more likely to develop ear infections. Dog breeds at risk include Basset Hounds, Beagles, Cocker Spaniels, German Shepherds, Golden Retrievers, Labradoodles, Poodles. Allergic skin disease is a common cause of ear infections because the inflamed ear is prone to developing bacterial and yeast infections. Grass, awns and other plant material can find its way into the ear canals of dogs with outdoor access, resulting in an ear infection. Young puppies and kittens, as opposed to adults, are most at risk of contracting ear mites. Occasionally, a tumor develops in the ear canal and sets off an infection. Since dogs and cats have vertical, L-shaped ear canals, the bottom of the canal tends to hold fluid. Activities such as swimming, bathing, or a visit to the groomers can also put pets at risk of an ear infection due to the increased moisture in their ears. Signs. Signs of an ear infection may include head shaking, redness or swelling, odor, scratching one or both ears, increased discharge/wax, darkened discharge, scaly, crusty, or scabby skin in ears. Avoiding head petting. Ear infections can occur in one or both ears. Early on, pets may not show signs of an ear infection apart from wax buildup and increased discharge in the ear canal. Diagnosis. In order to diagnose the underlying cause of an ear infection, your veterinarian will initially review your pet's medical history and perform a physical examination. The otoscope is a tool that's used to look closely inside the ear canal. Your veterinarian will use the otoscope to look for any abnormalities, such as signs of inflammation, impacted debris, parasites, or foreign objects. If your pet is in pain, it may be necessary for your veterinarian to sedate your pet in order to properly perform an otoscopic exam. Your veterinarian may swab the ears to check for any overgrowth of microorganisms or the presence of ear mites using a microscope. They may also want to take a culture of any discharge present to determine if there is a bacterial or yeast infection. There is also the possibility that there are several different types of infections present at the same time. If allergies are suspected, your veterinarian may treat with allergy medication or may recommend allergy testing for both environmental and dietary causes, as 50% of dogs with allergic skin disease and 80% with food sensitivities have some form of ear disease. If your veterinarian suspects a possible middle or inner ear infection, your pet will need diagnostic imaging, such as a CT scan, to evaluate the middle and inner ear. Middle and inner ear infections may require long-term antibiotics. Treatment. Your pet's treatment plan will depend on the underlying cause of infection. Your veterinarian will thoroughly clean your pet's ears first using a ME. Appropriately diagnosed, your veterinarian can recommend a treatment plan that is best suited to your cat's needs. CareCredit credit card financing for cats. The CareCredit credit card is an easy way to pay for your cat's annual checkups, food, and products at veterinary practices in the CareCredit network. Apply today and use our acceptance locator to find a veterinarian near you that accepts CareCredit to help keep your pet healthy and happy for a lifetime of love. CareCredit is there for you and your pet every step of the way. Continue your wellness journey by downloading the CareCredit mobile app to manage your account, find a provider on the go, and easily access the WellU Hub for more great articles, podcasts, and videos. Author bio. Dr. Elizabeth Racine is a small animal general practice veterinarian and freelance writer. She covers both human and veterinary medicine with a special interest in nutrition, internal medicine, and veterinary behavior. Domestic cats, Felis catus, comprise a small, 2%, of the non-rodent animals used in biomedical research. In 2011, 21,700 cats of a total 1,134,693 non-rodent animals were used in research, APHIS, 2011. According to the National Research Council Committee on Scientific and Humane Issues in the Use of Random Source Dogs and Cats in Research, National Research Council, 2009, peak use of cats occurred in 1974. Since that time, the number of cats used in research has fallen by 71%, with more than 98% of those cats being purpose-bred for research. Cats are a U.S. Department of Agriculture, USDA, covered species with special housing requirements defined in the Animal Welfare Act and the Guide for the Care and Use of Laboratory Animals, NRC, 2011. At the request of Congress, a committee of experts formed by the National Research Council examined the use of random-sourced dogs and cats and concluded that obtaining dogs and cats from Class B dealers is not necessary for NIH-funded research, National Research Council, 2009. While the number of cats used in biomedical research has declined, cats continue to contribute uniquely to biomedical science and are valuable research model for several disciplines, including aspects of neurology involved in locomotion and spinal trauma, retrovirus and zoonotic disease research, and for developing therapeutic strategies for inherited diseases. Keywords: cat, infectious disease, inherited disease. Introduction. A. Unique contributions of cats to biomedical research. Domestic cats, Felis catus, comprise a small, 2%, percentage of the non-rodent animals used in biomedical research. In 2011, 21,700 cats of a total 1,134,693 non-rodent animals were used in research, APHIS, 2011. According to the National Research Council Committee on Scientific and Humane Issues in the Use of Random-Sourced Dogs and Cats in Research, National Research Council, 2009, peak use of cats occurred in 1974. Since that time, the number of cats used in research has fallen by 71%, with mammary tumors are typical in unspayed females or those spayed after their first heat cycle. In cats, approximately 85% of mammary tumors are malignant. 4 Pet owners first notice a lump or mass in the mammary chain, or the veterinarian may palpate the mass during a routine examination. Surgery is the recommended treatment, sometimes in conjunction with chemotherapy. 17. Mast cell tumor. Mast cell tumors are the second most common skin tumors in cats. They can occur anywhere on the body but are mainly found on the head and neck, especially at the base of the ears. They typically appear as a firm, hairless, raised nodule, although their appearance can vary. Surgery to remove the tumor is the recommended treatment option in most cases. 18. Obesity. According to the Association for Pet Obesity Prevention, 59.5% of cats are classified as overweight or obese. 5 While the internet has popularized pet obesity with fun nicknames and memes, feline obesity is no laughing matter. It increases a cat's risk of developing many other diseases, including diabetes mellitus, osteoarthritis, heart disease and cancer. Obesity may also significantly impact a cat's lifespan and quality of life. 19. Osteoarthritis. Arthritis is incredibly common in cats, with one study finding that 90% of cats over the age of 12 had evidence of arthritis on X-rays. 6 Unfortunately, cats are very good at hiding their pain, and arthritis often goes undetected. Pet owners may notice symptoms such as hesitancy to jump, difficulty using stairs, an increase in sleeping and a dislike of being touched in certain areas. 20. Pancreatitis. Once thought to be rare in cats, we now know that pancreatitis is quite common. Inflammation of the pancreas can occur due to concurrent diseases such as diabetes mellitus, hepatic lipidosis and inflammatory bowel disease. In many cases, no inciting cause for pancreatitis is found. Symptoms include lethargy, loss of appetite, weight loss and vomiting. 21. Periodontal disease. Periodontal disease is the inflammation and infection of the structures that support the teeth, including the gums and bone. Studies show that between 50% and 90% of cats over the age of 4 have some form of dental disease. 7 Many cats show no symptoms of periodontal disease until it becomes severe. Symptoms noticed by pet owners include bad breath, drooling, dropping food, reluctance to eat hard foods, bleeding gums and oral pain. 22. Pyometra. Pyometra is an infection of the uterus that occurs in unspayed females. Symptoms usually start within 6 weeks of the cat's last heat cycle and can include lethargy, depression, fever, increased drinking and urinating, loss of appetite, vaginal discharge, abdominal pain and vomiting. Pyometra is an emergency condition and surgery to remove the infected uterus is strongly recommended. 23. Squamous cell carcinoma. Squamous cell carcinoma, SCC, is one of the most common skin tumors and the most common oral tumor in cats. As a skin tumor, ultraviolet light plays. FIP is a frequently fatal viral disease in cats caused by certain strains of feline coronavirus. It is most common in young cats less than 2 years of age, though geriatric cats are also susceptible. Purebred cats, male cats and cats housed in high-density facilities such as shelters and catteries are at higher risk of developing FIP. The first symptoms pet owners usually notice include nonspecific signs such as weight loss, lethargy, depression and fever. 7. Feline leukemia virus, FeLV. Feline leukemia virus is one of the most common infectious diseases in cats, with an estimated 2% to 3% of all cats in the United States infected. 2. The virus is spread from cat to cat through bite wounds, mutual grooming or sometimes even by sharing dishes and litter boxes, although this is rare. Kittens are most susceptible to FeLV infection. Cats with FeLV are more prone to cancer, blood disorders and secondary infections. Feline leukemia is preventable through vaccination. 8. Feline lower urinary tract disease, FLUT. FLUT is a catch-all term used to describe a variety of common bladder and urethra conditions in cats. While cats of any age can be affected, feline urinary tract disease is typical in middle-aged, overweight, indoor cats. Symptoms of FLUT include inappropriate urination, straining to urinate, frequent trips to the litter box, urinating in small volumes, blood in the urine and vocalizing while urinating. 9. Feline panleukopenia virus, feline distemper. Feline panleukopenia virus is a highly contagious virus found worldwide. It is also known as feline distemper or feline parvovirus. Young kittens are most susceptible to feline panleukopenia, but unvaccinated cats of any age can be affected. The virus attacks rapidly dividing cells in the intestine, bone marrow, and lymph nodes, leading to diarrhea, anemia, and a deficiency of white blood cells, panleukopenia. Feline panleukopenia is preventable through vaccination. 10. Fleas. Fleas are small insects that feed on blood, and they are extremely common worldwide. They are the most common external parasites of cats and dogs. The cat flea, Tennocephalides felis, can infest both cats and dogs. Not only can fleas cause itching and discomfort through their bites, but they can also spread diseases to your cat, such as tapeworm, Bartonella and Rickettsia. Many cats with fleas show no symptoms other than flea dirt, small, reddish-brown flecks of flea feces found in the coat. 11. Hyperthyroidism. Hyperthyroidism occurs when the thyroid gland overproduces and secretes excess thyroid hormone. This condition is typical in middle-aged and senior cats. Symptoms of hyperthyroidism include weight loss, ravenous appetite, excessive drinking and urinating, vomiting and increased vocalization. Multiple treatment options exist, including medication, diet and radioactive iodine therapy. 12. Hypertrophic cardiomyopathy, HCM. HCM is the most commonly diagnosed cardiac disease in cats. The condition causes a progressive thick. Cats infected with feline immunodeficiency virus, FIV, may not show symptoms until years after the initial infection occurred. Although the virus is slow-acting, a cat's immune system is severely weakened once the disease takes hold. This makes the cat susceptible to various secondary infections. Infected cats receiving supportive medical care and kept in a stress-free, indoor environment can live relatively comfortable lives for months to years before the disease reaches its chronic stages. Feline leukemia virus, FeLV. First discovered in the 1960s, feline leukemia virus is a transmittable RNA retrovirus that can severely inhibit a cat's immune system. It is one of the most commonly diagnosed causes of disease and death in domestic cats. Because the virus doesn't always manifest symptoms right away, any new cat entering a household, and any sick cat, should be tested for FALV. Heartworm. Spread by infected mosquitoes, heartworm is increasingly being recognized as an underlying cause of health problems in domestic cats. Cats are an atypical host for heartworms. Despite its name, heartworm primarily causes lung disease in cats. It is an important concern for any cat owner living in areas densely populated by mosquitoes, and prevention should be discussed with a veterinarian. High-rise syndrome. Many pet parents eagerly open their windows to enjoy the weather during the summer months. Unfortunately, unscreened windows pose a real danger to cats, who fall out of them so often that the veterinary profession has a name for the complaint: high-rise syndrome. Falls can result in shattered jaws, punctured lungs, broken limbs and pelvises, and even death. Rabies. Rabies is a viral disease that affects the brain and spinal cord of all mammals, including cats, dogs, and humans. This preventable disease has been reported in every state except Hawaii. There's good reason that the very word rabies evokes fear in people. Once symptoms appear, rabies is close to 100% fatal. Ringworm. Although the name suggests otherwise, ringworm isn't caused by a worm at all, but a fungus that can infect the skin, hair, and nails. Not uncommon in cats, this highly contagious disease can lead to patchy, circular areas of hair loss with central red rings. Also known as dermatophytosis, ringworm often spreads to other pets in the household, and to humans, too. Upper respiratory infections. A cat's upper respiratory tract, the nose, throat and sinus area, is susceptible to infections caused by a variety of viruses and bacteria. Worms. Cats can acquire a variety of intestinal parasites, including some that are commonly referred to as worms. Infestations of intestinal worms can cause a variety of symptoms. Sometimes cats demonstrate few to no outward signs of infection, and the infestation can go undetected despite being a potentially serious health problem. Some feline parasitic worms are hazards for human health as well. According to the American Veterinary Medical Association, there are more common cat diseases include feline leukemia virus, feline immunodeficiency virus, diabetes, kidney disease, dental disease, cancer, and upper respiratory infections. Other prevalent issues are feline infectious peritonitis, fleas, ringworm, and obesity. Here's a more detailed look at some common cat diseases. Infectious diseases. Feline leukemia virus, FALV, a retrovirus that weakens the immune system, making cats more vulnerable to other illnesses. Feline immunodeficiency virus, FIV, another retrovirus that impacts the immune system, similar to HIV in humans. Feline infectious peritonitis, FIP, a serious disease caused by a coronavirus, often fatal. Upper respiratory infections, URI, can be caused by viruses or bacteria, leading to sneezing, nasal discharge, and other symptoms. Ringworm, a fungal infection of the skin. Feline panleukopenia, FP, a highly contagious and potentially fatal viral disease. Other common diseases. Kidney disease. Cats can suffer from chronic kidney disease, which can worsen over time. Dental disease affects the teeth and gums, causing pain and potential infections. Diabetes, a metabolic disorder where the body doesn't produce enough insulin. Cancer can affect various parts of the body. Obesity, a growing concern in cats, potentially leading to other health problems. Feline lower urinary tract disease, FLUT, a group of conditions affecting the bladder and urethra. Heartworm, a mosquito-borne disease. Fleas can cause skin irritation and transmit diseases. Tapeworms, intestinal parasites. As a cat parent, it is important to recognize the signs and symptoms of common illnesses so you can seek veterinary help for your feline friend in a timely manner if necessary. Read on for information about diseases and other medical inflictions that frequently impact cats. Cancer. Cancer is a class of diseases in which cells grow uncontrollably, invade surrounding tissue and may spread to other areas of the body. As with people, cats can get various kinds of cancer. The disease can be localized, confined to one area, like a tumor, or generalized, spread throughout the body. Expand to read more. Diabetes. Diabetes in cats is a complex disease caused by either a lack of the hormone insulin or an inadequate response to insulin. After a cat eats, her digestive system breaks food into various components, including glucose, which is carried into her cells by insulin. When a cat does not produce insulin or cannot utilize it normally, her blood sugar levels elevate. The result is hyperglycemia, which, if left untreated, can cause many complicated health problems for a cat.